Imagine a family on a Friday night in their living room, relaxing, watching TV, swapping stories. Imagine the father, the mother, the 3 children are there, laughing, enjoying each other's company on a Friday night. It's relaxing. It's heartwarming, isn't it? Now imagine that same family where the mother has multiple bouts of TB which have failed to respond to treatment. Now she's been diagnosed with extensively drug-resistant TB, XDR-TB, and imagine she's still living in a house and her child has now become infected with XDR-TB. With limited treatment options for children with XDR-TB, that child may pass on while waiting for treatment. This is a sad truth that we're faced with every day in the TB world. TB is a global public health threat, and we all know the statistics. In 2014 alone, 1.5 million deaths were related to TB. It's been estimated that about 9.7% of patients with MDR-TB also have XDR-TB. So the question is, what are we as healthcare workers going to do to address this issue of TB? How are we going to achieve our goal of 0 deaths from TB? I would suggest to you that a way to do this is to learn more about new treatment regimens and new medicines such as bedaquiline and delamanid. For this purpose, a new e-learning course titled Using New TB Medicines and Regimens has been designed by the Systems for Improved Access to Pharmaceuticals and Services, SIAPS, with funding from USAID. This course is intended for use by all healthcare workers, including nurses, physicians, pharmacists, people who are involved in the management of patients with TB. Healthcare workers who are also within ministries of health, NGOs, national TB control programs can also benefit from this course, as there is information on recording and reporting requirements, clinical management of patients using new TB medicines and on the new regimen, pharmacovigilance and new TB medicines, ethical considerations and informed consent, and much more. All of this is available to you free of charge. Please be advised that the information in this course is not a substitute for clinical judgment or clinical expertise. Participants are advised to use this information at their own discretion and within their national MDR-TB guidelines within their country context. Welcome to the Using New TB Medicines and Regimens e-learning course, and happy learning.